Absolutely. Dr. Sonia Lal, have you, what has your experience been like? You've got years of experience as well. You deal with a branch of medicine where, the life and death is an everyday kind of business. Have you seen this kind of thing as well? It's being reported from everywhere.
Absolutely, Shivan. And this is just not an issue during COVID, right?
Yes,
this
exactly.
is an issue that's been there for the longest time, and it's really prevalent in India. You do not see it to this extent in any other country in the world to what we see in India, and it's very, very disheartening. And what we're not realizing that what is the impact it is doing on healthcare. On one end, we are having discussions that health, we have to increase our healthcare staff.
Yeah.
We do not have enough healthcare professionals, and the COVID pandemic is an example of how much shortage India is actually facing when it comes to that. But how will people get into this field if they're scared for their lives?
Absolutely.
So the government really has to, I think, come forward at this point. So definitely that fear is there. And as a neurologist, I can tell you, when I deal with the brain,
yes,
and from a psychological standpoint, the impact that this is having, the fear. See, no doctor wakes up in the morning thinking that I'm going to go and I'm going to harm my patient.
Yeah.
Every single person wants to take care of their patient. Unfortunately, sometimes things are out of hand. But to live in that fear, anxiety, depression, to have insomnia, to have the fear that if I treat this patient and 1% if something goes wrong, I might be killed myself.
Yeah.
That is a very scary feeling.
That's scary.
The doctors are, I think, going through. So it is high time, steps are taken. Otherwise, it is eventually who's going to suffer. People are not realizing it is the patients who will eventually suffer, because when the shortage will be there, when we won't have enough healthcare people, what will we do?
Exactly. I mean, Dr. Sameer Gupta, coming to you, you're a cardiologist, sir. Someone just shared something with me on social media. I want to read it out and tell me if you agree with this, because it looks absolutely correct to me, and it's the scariest part. When I promoted this show on social media, someone replied saying, every time a doctor is assaulted, another 100 doctors will stop taking the risks they would usually take to save someone. Unfortunately, your loved one will bear the price of it and you wouldn't even know. Is that true, sir?
100%. Let me echo what Dr. Sonia also said, that no doctor wakes up in the morning saying, you know what, today I'm going to go kill this patient. No, I really don't know of anyone who would intentionally or unintentionally do anything to harm their patient. When you become a doctor, you become a healer.
Yeah.
You want to treat people. You want them to get better. And every doctor realizes that unka naam dena, that they will grow when their patients get better outcomes.
Absolutely.
What you've heard in social media now, let me tell you a little bit. I'm an interventional cardiologist, and I treat the sickest of the sick people when people are coming with cardiogenic shock, with heart attacks, and you're operating on these people. And many times when these people are sick, they come down from the hospitals. And where there are competent doctors, I know some of these doctors, and the patients are referred from them to our center as a center of excellence. And, and you start talking to the family members, and they say, that, oh, that doctor felt that he could not operate over there, or he felt that, he doesn't want to take the risk over there, or something of that sort. And that is the unfortunate reality. People are going to start turning away sick patients.
Yeah.
And who's going to suffer in the end? The patient, the family, society. They are the people who will suffer. That 1 minute of violence that may do, that those family members may do, those relatives may do, or the friends may do, will have a long-lasting impact, not only on that particular doctor, but on healthcare professionals across the country, that it could be me next.
Yeah.
That is what the doctor is thinking.
So doctors
And
might
it's
actually
very
stop taking risks. A decision that might actually save the life of a patient. A doctor might say, I might get attacked for taking this particular decision. So why should I even bother taking this risk? And, like all of you have said, and Dr. Jailal also said, this isn't only happening during COVID, but it's happening much more during COVID because of the number of deaths that are actually taking place. But let me just remind our viewers about how many cases there have been. It's not for the first time. The Assam case, the Chikmagalur case in Karnataka, not the first time that healthcare workers, nurses and doctors have been assaulted in this manner, harassed and, savagely assaulted during the pandemic. From Delhi to Uttar Pradesh to Karnataka. Remember the Apollo Hospital incident in the national capital. Cases of assaults that you can see on your screen are all well-documented stories where tempers have flared after the death of a loved one, and patients' families have taken the law into their own hands with very, very bloody consequences at those healthcare facilities. Dr. Jailal, what is your message to young doctors out there? You know, I don't see, there are special laws and special provisions. You've heard the three doctors on our show. There are many young doctors and residents across the country, who are already burdened. They're already facing a lot of trauma. What kind of assurance can you give them, sir, that they will not be at risk? Because so far, nothing appears to have been done from the government side.
Yeah, we just talked with them and we said there is nothing adventurism in the medical field, and please take it in a positive sense. And this is one of the professional hazard which you have to face, but take care. And this is only a rare incidents which are taking place, though it is 4 incidents has taken place, but we must also believe 99% of the patients who we are seeing and we are treating is respecting you. They are taking care of you. They are thankful to you. And these are the people, these are the only stray incidents, and do not get swayed by this. And we will be taking enough steps to stop this. But please be positive and go ahead in your professional life. And I'm sure the grace of God will be with you to protect you all. Then this is a statement which you are making to our youngsters to go ahead with a positive framework, even in this pandemic, though there is life is at stake at this moment.
But, I want to, before I go back to our doctors, I want to just play out for you. We've listed out, the shocking triggers when doctors are attacked. What actually happens to them? Of course, one of the things can be physical harm. They can be attacked with implements. They can be punched. They can be kicked, as we just saw in the Assam incident. Apart from that, there is the risk of infection, from people who are attacking them in this manner. There is mental trauma after the attack. After being attacked, they're going to rethink the way they do everything inside a hospital ward. This can make doctors wary and less empathetic towards patients going forward. That's also a possibility, because they will obviously need to protect themselves. And the doctor may lose focus when they are needed, to have focus the most. Am I right, Dr. Mahima Bakshi? How do doctors deal with this? We are very clear now that it has a ripple effect. If one doctor gets attacked in this manner, other doctors are also affected in this manner. But what happens to a doctor when they get attacked like this, ma'am?
Absolutely, like Dr. Sonia ma'am was also mentioning, there's a lot of mental effect also that happens. There's trauma, the episodes of what, had happened, what the doctor went through, it keeps on repeating again and again in their minds. And hence, it's quite possible that for a while it might demotivate the doctor to help patients, because it's not easy for anybody to go through trauma. And plus, the repercussions on the other colleagues, where, everybody feels for the situation, for what is happening to the doctor's fraternity. So obviously, there's going to be a lot of anger also building inside, because it's just unacceptable.
Yes.
People who are out there serving. I mean, imagine if people go and start attacking people, serving in the army. How would they react? How would they feel? So similarly, when they are being called frontline workers and they're there helping people in COVID times, putting their families at risk, imagine how would they feel that this is what they're getting in return for serving the humanity like this. So it's totally unacceptable, and I feel that all the appeals that have been made by IMA, government should consider and take an immediate action. And in fact, not just physical abuse. I would like to mention here that even things like verbal abuse, for example,
and there is so much of that.
The statements made by Baba Ramdev recently, or other people who go and make such statements on public platforms about allopathy or about doctors, it's very unfortunate to see such incidents happening again and again in India. I feel somewhere a line has to be drawn so that doctors are respected in the society, and they are giving that type of security so that they feel secured while serving patients in the hospitals.
Dr. Sonia Lal, you're a director at a very well-known hospital as well. How do hospitals deal with this, ma'am? There is obviously a very strict policy as far as, doctors or staff being attacked in any manner. But if a doctor is attacked in this manner, what are the steps that a hospital takes to make sure that this, A, it doesn't happen again, and B, that the doctor is taken care of?
Absolutely, so Shiv, it's important for the hospital, like even in our hospital, you actually create emergency protection team of sorts. That's what we have done, In case an incident like this happens, the team is activated right away. And these consist of people, who have maybe worked in the army, who are from, if we have to call in, somebody from the police, we will call in that as needed. But the healthcare, we have teams that are ready to deal with it. Of course, we enhance our security. That has always been the case. I think when we've had episodes, the COVID has still changed the atmosphere a little bit, where a little bit more respect is being given. We've healthcare workers have gone through a lot of hell in the past, where it was a very bad situation where we were always abused. So it was, having enhanced security by the hospitals, they're definitely doing that. They're definitely creating teams. But I think the biggest problem is, there are times when villages come in, there are times when there are 50 people coming in from, a particular village, and they want to break the hospital, they want to attack the
like
doctor.
What happened in the Assam incident.
What do we do in that situation? I think, and that is why it's very important. And I'm thankful that the IMA is actually now, again, they're approaching the government, they're requesting, because until stringent laws where proper action is not taken, if they are not put in place, we can speak about this forever, and this will always be a problem. So really action needs to be taken. I think this is high time now that actually people are put behind bars. There is actually some action taken, and then that fear comes up that yes, if we hurt the doctors, action will be taken against us. Because people are confident that there will be no action.
Because
somewhere that is the problem.
The truth is, families sometimes put it to grief. Losing control in the grief of the moment, or that a doctor was rude or empathetic, or a doctor was, acting greedy and not giving proper service. All these are shocking excuses, in my opinion, because what we've established here in this show is that when you attack a doctor, you're harming patients' own health and the health of other patients and doctors in the future as well. So you're actually harming the entire healthcare system with just one single attack. And Dr. Sameer Gupta, the incidents have also shown that this isn't just something that's happening in government hospitals, it's happening in private hospitals. We saw what happened in Apollo Hospital of Delhi last year. It's happened in other hospitals in Gurgaon this year as well. But how bad is it in the government hospitals vis-a-vis the private hospitals, sir, where the burden is perhaps much more?
I think this is a society problem. I wouldn't limit it to just government or private hospitals. I think this is a problem or attitude which is there across everyone. And when I trained, I worked at one of the very popular and a very busy government hospital. And this incident was at least every other day. It may be a minor incident, or maybe it may just be a threat, but it was not something which was uncommon, especially in the emergency department and in some of the surgical departments where there's a lot of acuity and there's a lot of deaths. Yes, this is something which is prevalent. I think it's across hospitals, across different strata, and this is something which needs to be dealt with. And I'm very glad, like Dr. Lal said, that that the IMA is taking a very strong stand for it.
Dr. Gupta, Dr. Sameer Gupta, is there any question you'd like to ask directly to Dr. Jailal? Because this is something that's been going on for many, many years. Any direct question you'd like to ask about whether things will be different this time around?
Yes, Dr. Jailal, I think please tell me, when we you as the medical head of the IMA, as a leader of all the doctors, when do you foresee that we will be able to practice medicine and take care of our patients without feeling the threat of being harmed, and get that peace of mind? So all our focus just goes on patient care and not on, oh my God, what am I going to do if somebody attacks me? Yeah, the attendants are very, very scary. Let's call the hospital administration and tell them that, why don't you send some backup cases because these attendants are doing this. So, I think, Dr. Jailal, please, I know you guys are working very hard, and I think all of us on this panel really appreciate all the work that you're doing as the president, sir. And thank you for doing that. But I hope that this time it's a little bit different.
Dr. Jailal.
We share the same sentiment and same pain we are feeling, but we have taken this issue very closely with the government. I talked with the Home Secretary and the Health Secretary also. They are assured that they will definitely look into this time little more efficiently. What we have now requested the government is to make the security system inside the hospital more very stringent. as such, as on date, in any government hospital, there is no security system is available. The government should take that as a responsibility. They have assured literally. And our main demand now at this moment is make and declare every hospital, at least a big center hospital, as a security zone or security center. So if it is that concept, then it is a responsibility of maintaining the safety and security comes to the administration comes to the police station.
Yes.
They will take more care. Our demand is not that do something for when the people are getting affected, but it is that we need to prevent that.
Absolutely. No, I think that's a great note to end on. It's about prevention. It's not just about acting after a doctor has been attacked. The whole point is that a system needs to be created, an atmosphere needs to be created, an example needs to be set in such a way that nobody even thinks of attacking a doctor in this manner. Whether it is systemic, whether it is about the law enforcement, whether it is about enforcing the existing provisions rather than simply mixing things up and demanding special separate provisions, that perhaps holds the key. I'd like to thank Dr. Jailal for being with us today, making that assurance not just to the 3 doctors we have on our panel today, but also to young doctors in their thousands who are watching from across the country and indeed across the world. And also to Dr. Mahima Bakshi, Dr. Sonia Lal and Dr. Sameer Gupta. Always a pleasure. Thank you so much for sharing your experiences with us and sharing your wisdom on an issue we face every single day here in this country. Thank you so much. And just as a reminder of how young doctors are on the front lines and sometimes having to sacrifice their lives, take a look at this story of a young 23-year-old MBBS topper from Andhra Pradesh who succumbed to COVID-19 while fighting to save the lives of others.
She was like just another young girl who lived life to the fullest. 23-year-old K. Roji was a house surgeon in Andhra Pradesh. A COVID warrior, she had been at the forefront of the fight against the pandemic. Dr. Roji had completed her MBBS at Alluri Sita Ramaraju Academy at Medical Sciences in Elluru. And it was at the same hospital that she was performing her duties as a house surgeon while pursuing her MS. As the second wave wreaked havoc, Roji was actively involved in saving the lives of those infected with virus. But as she performed her duty, Dr. Roji herself got infected a few days ago. And condition continued to deteriorate. She fought hard, but tragically succumbed.
She was such a brave one that she chose to do work with this COVID patient. And I feel so sad that she couldn't fight this battle.
Hailing from a small village called Mori in Andhra Pradesh, Roji was an MBBS topper. The villagers remember her as a brave heart.